Welcome back, millions, to my channel of Aspie Answers. And to those who are new, I'm Addie Answers. I'm a host, content creator, advocate, navigator, navigating through life with autism, ADHD, of my current new diagnosis, as well as some mental illnesses. I take you all on a journey with travel, fun and games, and so on and so forth. So if you're into any of these and more, feel free to smash that subscribe button on the bottom right hand corner and turn on the notifications so you don't miss anything I post. Because as I said, I usually post daily or even 3 times a week, but this may schedule to change after New Year's, but I'll hope to keep it posted after New Year's is over and let you know of my new posting schedule. So it has been brought to my attention. I have been trying to bring out some awareness and understanding and knowledge and know-how about ADHD, especially since now with my life experiences with ADHD especially, I thought to share with you all covering those topics. And in the very first one, I was talking about what is ADHD as the classic example, like definition and what have you, and saying that also in that definition we'll hopefully cover, as I said, about 30 small topics that I may have not brought out like in the past and bringing it out in the present, which I'm hoping, and this also while I'm bringing them out here will be on my actual podcast if you want to just listen more than just watching my face on the screen here, to give you guys alternative options right now. So if you haven't seen that one, I suggest in the icon above me will be that video, as well as in the description box of the very first part of it as well, because obviously that is a brand new layout system that I'm doing. And in saying this, I'm going to cover now the 7 different types of ADHD or ADD according to Dr. Daniel Armin. And obviously in saying this, in this topic I was hoping to cover today the scans and Dr. Armin in itself of who he is and what he is based on this, and then in that autism versus ADHD different type of it, the definition and why it's important to talk about it, as well as in saying this is also the 7 types, which are your classic ADD or ADHD, type 2 is inattentive ADD, ADHD, type 3 overfocused ADHD, type 4 temporal lobe ADD, ADHD, type 5 is your limbic ADD, ADHD, type 6 is your ring of fire ADD, ADHD, and type 7 is anxious ADD, ADHD. And to end this before that, also as a cover for today will be the difference between ADHD diagnosis and exploring the elements of it, why it's important, and so on and so forth. So in all further ado, so let's begin this. Obviously you may be questioning who is Dr. Armin, or Dr. Daniel Armin more specifically of his name. He is obviously a pioneer of the neuroscience field based on what he does with his work based on SPECT imaging. SPECT imaging stands for single photon emission computerized tomography. In layman terms, it's a type of non-invasive nuclear imaging test that allows your doctors to see how well your internal organs are functioning. It uses a radioactive substance and a special camera to create the 3D pictures of your organs at different angles, or more to be easier to understood, most specifically it's most commonly used for knowing what's going on inside our brain. So, but more in general, I'll give you, based on this, as you could see just now, is how it works. Yet I'm going to try and be as brief as possible for how it works, gain the better understanding for us all to actually gain from. So as I said, the scan of the SPECT uses a radioactive material called a tracer, which the tracer is then injected intravenously inside you. Based on that will mix with your blood. As your blood moves through your body, it's taken up or absorbed by your living heart muscle. The DigiRad Cardiac X3X Pro and X Plus allows for the patients to be imaged in a comfortable seated position, but other gamma cameras will require you to lay down, hence the clear illustration earlier. During the scan, the SPECT camera rotates around you. It will then pick up signals from the radioactive tracer while you're lying down, or whatever way you're doing this, are then converted into your 3D images by the computer. When you undergo a nuclear stress test, however, the SPECT scan will be taken while you're exercising, again when you are at rest. However, the comparison of the images will then allow the physician that is treating you to evaluate the blood flow under the different levels of exertion, stress, and other conditions and elements. Your images then may show different shades of color that will indicate which area of your heart has been absorbed more of the radioactive tracer that was given to you intravenously, and then it will also show you which areas will absorb the less area of the actual tracer. A normal test usually will indicate there is sufficient and unrestricted blood flow to your heart, while the abnormal result means that your heart blood flow is insufficient. Once your physician reviews this, you will meet to discuss the results if any necessary treatment is required to do so. As these types of scan has been introduced to us today moreover than ever before, it has opened up so many possibilities of what's going on inside our brain especially, and to treat and diagnose anything around mental health. This is what it's clearly used for. I was trying to find an image based on an autism versus normal brain, and an ADHD brain versus a normal brain versus an ADHD brain versus an autistic brain again, so that you can clearly see the difference. But I'll hopefully share this more in depth later on about the differences of the components of these different diagnoses brains, especially to gain a better understanding. So stay tuned for that if you're wanting to know more about this, to gain that clearer understanding. So more about Dr. Amen himself though, however, he has used dozens of these to categorize the different type or subtype of ADHD or ADD, as some might call it, into these 7 specific categories that I'm going to illustrate you all today, gain a better understanding and how it works. In his field of work, however, he has also developed 7 highly specialized treatment plans for each of these different representations of ADD, ADHD. And more so, I'm going to, while I'm covering this, link some resources and information because I won't be able to cover everything in really depth today. So if you want to find out more based on Dr. Amen's work, some of that information will be there, as well as just some of my research and findings of what I've done. He also has written a couple of books, which is going to be in the description box, which is called Change Your Brain, Change Your Life. Dr. Amen to many is known as a life savior who wants to dive more into how the brain works, as well as just having a holistic approach to healing or managing the conditions, as well as on the same the sound advice based on relationship, emotional and spiritual health, so on and so forth. So you may be wondering, what's the difference between autism and ADD? I've got a diagram above me, hopefully, that will show the differences or the overlap of autism and ADHD, because clearly they have similar symptoms and characteristic traits, so on and so forth. So the term, as we know, of autism has many different definitions from so many experts in this diagnostic field, obviously, but yet it has been known mankind it is defined as a complex developmental condition that involves persistent challenges in communication, social interaction with their peers, persistent challenges again or restricted interests, and repetitive behaviors. Impairments of these will vary from person to person, however, as we know, vastly based on their age and developmental stages of their life, so on and so forth. Some may have these maybe early in their life, so they may start showing these classic signs of autism based on maybe their tender age, as I said, 2 or 3 years old, or even like later in later years, even though many do get misdiagnosed or what have you for this. So I have done one about misdiagnosis in females, especially with autism, which I'll link in the iCard in the description box below you, so you can have a listen to that. On the other hand, ADHD definition, or as it's known for this long abbreviated term, is attention deficit hyperactive disorder. Correction. That is commonly used for or used of this classic signs of inattention, distractibility, and poor working memory, and it is also described as additional symptoms of hyperactivity and impulsivity. But again, that will vary from person to person based on their developmental stage and what have you, and I have clearly shared based on the 3 types of autism that is clearly shown, which is in my previous video, which I'll link in the icon above me and in the description box below me. So these 2 are both categorized, however, as neurodevelopmental conditions, right? So neurodevelopmental is only defined as just in reference to your nervous system. With the overlapping of the 2, however, it can be hard to recognize or distinguish between the 2 of them, and sometimes they can also become polar opposite one another. As this with these 2 conditions can make the person feel stuck between like gears, like imagine yourself being in a car and it like you're driving along comfortably, and then all of a sudden you're at a stop at a traffic light for starters, and then once it goes green, you're going again. So it's almost like you're switching between car gears also if you're in a car with certain speed levels and what have you. That's how I basically look at it. And then they're also known for as being awkward, and they don't know or may not know how to move forward with their life or just moving forward in their everyday living on how they can adjust things accordingly to themselves. A very important question we should be asking yourself is, why is it important to talk about ADD or ADHD? Even though it may not be a taboo topic as much nowadays when it has been shared in the past, but according to ADD, ADHD research or studies, for the reason behind this, that less than half of the people with ADD, ADHD, however, are being diagnosed with or being treated with the symptoms of ADD, ADHD symptoms, or even vice versa. It could be the same as for us being diagnosed with autism, so to speak. Again, the same retrospect. Again, also in saying that, like I said before, of that overlapping between autism and ADHD based on this, of the similarities, the differences, and the characteristic traits, signs, symptoms, and so on and so forth, based on that can also be led to people being misdiagnosed regardless of their age and stage of life. However, I have shared about the misdiagnosis, as I said, about autism and my life story with it, about being diagnosed with Aspie's syndrome. So if you want to know more about myself as an autistic, I'll link it in the icon on the description box below me so that you can gain a better understanding about me as an autistic especially. But just to bear in mind though, for us gender of the females, basically with ADHD or ADD are usually the ones that are being misdiagnosed or even underdiagnosed, similarly again to when we are actually going for a diagnosis based on ADHD, ADD and the like, because obviously the reason for this is, especially for us being misdiagnosed or misrepresented in ADHD is because we tend to, hide the fact of that hyperactive word. We may look more calmer to certain people. So, and usually this will, for hiding that part of hyperactivity, we're not drawing a lot of attention to ourselves. We're drawing at less attention, unlike for some that will have that hyperactive factor that they will, bring attention to themselves and so on and so forth. I've got to remember, if it's left untreated, like many conditions, it will cause many problems in navigating through our everyday life, so that we can actually understand more about ourselves and how we work and so on and so forth. So the statistics of ADHD, however, will vary from different countries, and it will obviously not just saying in the variation of those everyday statistics I've been reading, it will be changing constantly based on every year, that depending on the specifics of the actual research that they're doing based on the statistics will eventually change over time again. But bear in mind also, as I'm sharing this right now in this part before I get into the 7 types or subtypes of the ADD, ADHD, is that I've been researching it through American websites versus Aussie, Australia, UK, the most common, countries that may likely to have this right now. But the statistics in general that I was reading from is according to one of the American research paper, the year of 2021, and this was last researched. Again, it will change over time depending on how they go about diagnosing and treating people with autism, ADHD, and other significant conditions that may play a role. So ADHD occurs more in men, which is 12.9%, than in women, which is 4.9% in the American statistics it reads today. Parents of a child with ADHD, however, bear 5 times more cost than without them. Children are most usually diagnosed with ADHD between the ages of 6 to 11, so most of the children will be around the 9% mark in America. However, over 40% of children with ADHD also have a parent with this disorder. About 35% of teens with ADHD will drop out of school. As many as 27% of teens who have substance abuse disorder will likely to have ADHD also. Around 51% of teenage girls with ADHD have self-injured. Severe ADHD cases might reduce our life expectancy by 25 years. Astoundingly, 41.3%, however, of adult ADHDers out there may cases are considered severe. 1 in 4 women, however, with ADHD has attempted suicide. It has also been shown that 30 to 50% of people diagnosed with ADHD will be on the autism spectrum as well. Up to 2/3 of the population shows that people with ADD or ADHD will also show that they're on the autism spectrum. This is important to share the importance of this relationship between the 7 types of ADHD according to Dr. Armin. So then, therefore, basically, based on this, he has also done, based on these 7 subtypes or types of it, that he's done some specialized treatment plans for each of these, which hopefully in the next video, based on my research and findings of these 7 classic ones, will bring out the treatment plan and so on and so forth for these types that I'm bringing out to you today. So type 1 is your classic ADD, ADHD. This is evident in early life and may refer more over towards ADHD as a classic term that we are usually used to using today. It's got the classic hyperactivity element or component, but it's not always present in the person, okay? Because obviously the characteristic in this one are shown in the last video as inattentive, distractible, disorganized, restless, and impulsive. Type 2 is your inattentive ADHD. As a reminder, this is characterized by easily distracted with low attention span, but not hyperactive. Instead of someone with inattentive ADD or ADHD, they may appear sluggish or apathetic, may also appear quiet or introverted. They may not tend to draw attention to themselves, that are negative attention, mind you, as much as someone with your classic ADHD, for example. So type 3 is your over-focused ADHD, or ADD, as I've been putting it, is. And if you're wondering what this abbreviative term, I have clearly shared what ADD is and the definition of it and so on and so forth, which I'll link in the archive and in the description box below me, and hopefully in saying this, it'll be in the playlist somewhere too to find it. But if you want to know what it is, it's attention deficit disorder for short, for the shorter abbreviated term as it comes down to. Type 3, over-focused ADD. Excessive worrying, they're argumentative and compulsive. They often get locked in a spiral of negative thought. People with over-focused ADD may have difficulty shifting their attention preservation, which is being stuck on a given topic and not being able to get off that given topic. Again, they're not being able to shift gears to remove themselves off that topic to something different to include the actual recipient in that part of the conversation to engage in together. You may be seeing right now as I'm sharing this again in the overlap of autism and ADHD, well, I'm sharing this to you all based on this type especially. This also can be found in substance users, abusers, or children and grandchildren of alcoholics. So type 4 is listed as your temporal lobe ADD. This is classic ADD plus the temper, quick temper and rage, periods of panic and fear, mildly paranoid. However, it's not unusual to see these classic signs in people who has head injuries, however, or has suffered from some brain trauma in their life besides the brain injury in itself. Type 5, limbic ADD. This is characterized by moodiness, low energy, may be socially isolated in themselves, may have low-grade chronic depression, frequent feelings of hopelessness. This is involved in the prefrontal cortex of the brain, obviously, because obviously it works overdrive. Well, it's not in an overdrive state, it's an underactive when it comes down to us concentrating, and then the deep limbic area of the brain controls our emotions of either being happy or sad, as an example, will then become overactive. Based on what I just shared with you, it may be sounding similar to the signs of depression. So don't get this confused with depression, however, because it's important to have someone that really knows what they're talking about here and can differentiate between the two of depression and this type of ADD. It looks down into the developmental history of the individual combined with the brain scan that will help to differentiate between the two, as I classically mentioned earlier about the SCAT scan. Number 6, or the type 6 of ADD, is the ring of fire. This is characterized as being angry, aggressive, sensitive to noise, light touch, close. They're often inflexible. They may experience periods of mean, unpredictable behaviors and grandiose thinking. In general, this is all about basically the high overactivity in our brain. Again, if you have this type of ADD, you may feel overwhelmed with your thoughts and emotion, and this type will be closely related to a diagnosis of bipolar disorder. The main difference between the two, though, to gain that understanding, will be that the ring of ADD is more of a constant condition, and with the bipolar condition that you may have, it will be more cyclical. You may notice again a crossover of the ring of fire ADD and autism in terms of being really sensitive to light, sound and touch, and so on and so forth of the classic senses. So type 7, last but not least, is your anxious ADD. This is characterized as being anxious, hence the type or characteristic, what have you. So I'm saying this, you could be tense, nervous, predicting the worst outcome of any given situation that you are in, getting anxious with the timed test that you're doing in an exam, or if you're doing something that is a timely manner at work that you have to do in a deadline-based structure. You may go through highs and lows of social anxiety, may often have physical stress symptoms such as your headache, earache, gastrointestinal issues, the digestive system will have problems digesting food, or just, really ill to the stomach that it's tight and not. And obviously this type will maybe also be conflict avoidant. So last but not least before I end this is difference between ADHD diagnosis and just experience a few. Now we have come to understand the different types of ADHD or ADD, that there will be some classic moments that we'll feel that we are in control, and if these symptoms that are shared present today, will often feel that we are in control. If these symptoms do persist on a daily though, however, having difficulties doing these everyday tasks that people take for granted, in life, such as keeping relationships going versus a career going and so on and so forth, that is, that you're dealing with more than just the actual condition in itself, rather than feeling forgetful, scatterbrained, etc. Why is this? This is usually when it interferes with your daily life of living, that it's consistent and it has gone on for as long as you can remember. Will be it for now. As I said, for the 7 classic symptoms, I'm gonna try to do more about the treatments of it with the research, so stay tuned for that. But in the meantime, above me there'll be 2 different videos, one with the playlist hopefully with ADHD versus autism brain and so on and so forth,